The following video is for educational purposes only. Please use this information with discretion. Our intent is to help you become a more informed healthcare consumer. Ortho University presents Cubital Tunnel Syndrome by Dr. David Eisenhauer. And now it's time to OrthoU.
Hello, I'm Dr. David Eisenhauer. I'm a board-certified and dual fellowship-trained orthopedic surgeon here today to discuss cubital tunnel syndrome. We will discuss the diagnosis and treatment of cubital tunnel syndrome, giving you some self-diagnostic tools as well as some home treatment remedies which may help save you that initial doctor's office visit. So first of all, what is cubital tunnel syndrome? This is compression of the ulnar nerve at the elbow. This sounds like carpal tunnel syndrome, and the pathology is very similar. Carpal tunnel syndrome, however, occurs at the wrist, where the median nerve is compressed beneath the carpal tunnel ligament. This nerve gives feeling to these three fingers and actually the thumb side of the ring finger. However, cubital tunnel syndrome, or compression of the ulnar nerve at the elbow, presents oftentimes with symptoms on the other side of the hand. So it's kind of the opposite of carpal tunnel syndrome. The pinky finger will get numb and the outside of the ring finger along with the ulnar aspect of the hand. The symptoms typically present here, although the pathology occurs up at the elbow. The nerve can be swollen within its sheath, or there can be localized inflammation or swelling of the muscles or the local tissues, causing some nerve compression. It's kind of like sitting cross-legged for too long and the foot falling asleep. That's what's happening with cubital tunnel syndrome. There's something around the nerve that's causing some pressure on the nerve and then causing the hand to fall asleep. This is usually something that occurs insidiously and relatively slowly. There are cases of acute cubital tunnel syndrome where there is a trauma or damage to the nerve directly, which can cause some numbness to the hand, although most of the time this is something that comes about relatively slowly. We see this more commonly in patients with diabetes and hypothyroidism, some autoimmune diseases. Some issues with swelling or inflammation in the body puts patients more prone to developing this. Patients oftentimes will have symptoms at nighttime, so they'll tell me that they awaken at nighttime and they have to shake their arm or shake their hand. Oftentimes it's difficult for them to tell which fingers are numb and tingly until we really isolate and pinpoint and ask them, and oh yeah, it's this side of the hand, they'll tell me. It tends to be more bothersome anytime the elbows are flexed. So in patients who are on the phone a lot or reading or on a keyboard in this position, this nerve runs behind the elbow. This is the funny bone nerve. And so when the elbow is bent, it actually stretches the nerve and kinks the nerve, and it makes the symptoms more prominent. That's why the symptoms tend to be more prominent at nighttime. When we sleep, we tend to sleep in this position, which kinks the nerve. So other symptoms associated with cubital tunnel syndrome, other than numbness into this part of the hand, could be weakness and clumsiness. This nerve also gives muscle innervation to the little interosseous muscles between the fingers and the thumb that allow us this motion right here. And so as this disease process progresses to the point of moderate or severe nerve compression, these muscles can become affected and can become weak. Patients will complain of weakness with their grip or grasp. They'll complain of clumsiness of the hand. So what are some self-diagnostic tools? Basically, you need to pinpoint where your numbness is located. Is it in the ulnar aspect, or is it over in the thumb, index, and middle finger side of the hand? If it is in the ulnar aspect of the hand, is it just the fingers, or does it involve the entire hand, or sometimes even up into the forearm? Occasionally, the ulnar nerve can be compressed further down here at the wrist. It's not carpal tunnel syndrome. It's something called Guillaume's canal syndrome. But rarely, but occasionally, the nerve can be compressed down here, and so the symptoms are a little bit different with that. By far, the most common ulnar nerve compression is cubital tunnel syndrome at the elbow, leading to symptoms in the hand. Something else that you can do is called a Tinel's test, where you tap over that nerve from up above the elbow to down below the elbow. And if that nerve is irritated, generally patients will feel a tingling or an electric shock into that aspect of the hand. That's one of the most potent diagnostic tools that I use in the office to elicit ulnar nerve pathology. You can also do an elbow flexion test. And so in patients who have intermittent symptoms, if they bend their elbows up deeply and hold it there for about 60 to 90 seconds, oftentimes those fingers, that part of the hand, will start going numb. That's a positive elbow flexion test. In the office, those are the tests that I do essentially. If patients have severe cubital tunnel syndrome type symptoms, meaning they have constant numbness and tingling or weakness of the hands, or if this is really painful for the patients, I'll oftentimes send them out for an EMG study or a nerve study, and that checks the flow of electricity from the neck down to the fingertips, and that can confirm a diagnosis of cubital tunnel syndrome and tell me, is this mild, moderate, or severe? However, the EMG misses this in about 20% of patients, actually. So sometimes patients will present with very clear-cut symptoms, however, their nerve study is normal. So we treat the patients, not the nerve symptoms, or not the nerve study, rather.
We pause now with 2 minutes left in the video and ask that you open a separate browser screen and go to MoonlightOrtho.com, where you can quickly register for a free patient account and get immediate access to the final portion of this video, including home treatments and remedies, along with any additional treatments that may be prescribed or recommended in office or via telemedicine, including when it may be time to consider surgery. This also gives you full access to the entire OrthoU video library, highlighting all of the most common orthopedic conditions. Once registered on Moonlight Ortho, patients will have an all-inclusive orthopedic telehealth hub at their fingertips and can pay to be seen by a board-certified and fellowship-trained orthopedic surgeon. Moonlight Ortho is the first and only orthopedic-specific telemedicine practice where patients can be seen online by a board-certified orthopedic surgeon. Via telemedicine, patients can receive X-ray, MRI, lab, and physical therapy orders, along with prescription medications, all within 24 to 36 hours from your time of visit. Thank you for watching, and if you enjoyed this video and appreciate the free advice that our surgeons have offered you, please rate and subscribe.